Okay, down and dirty, everything for the most part you need to know about group beta strep in pregnancy and why we recommend antibiotics in labor. Group beta strep is a naturally occurring bacteria that lives on about 35% of people's skin in their Netherlands. And most of the time, it doesn't cause anybody any trouble. But if you are positive for group beta strep bacteria and your baby comes into contact with it, it can make your baby very sick. I was group beta strep positive for both of my pregnancies. And for me, after learning about group beta strep, what it was, and the risks and benefits of using antibiotics in labor, it was an obvious choice for me to take the antibiotics in labor. I want you to make all of your own informed and empowered decisions. My only job is to give you the information that you might need in order to make that decision. So they test for group beta strep kind of in a similar way that they would test for strep throat, except it's not this hole, it's that hole's down there. Just a little like that. And if it makes you very uncomfortable to have somebody down there, you can actually ask if you can do it yourself. The accuracy rates are similar if you do it correctly. I don't want that to be a reason that you don't get tested. So group beta strep is something that you will not know that you have. I was shocked whenever I found out I was GBS positive. I'm like, do I have an STD? It is not an STD. It normally occurs on the skin about 30 to 40% of people. But it's important that we know who's positive and who's negative so we can identify those most at risk for their babies coming into contact with that group beta strep bacteria. All this information is going to come from evidence-based birth, so you can go there and read up even more. So if you are GBS positive and you come in labor, we recommend that you get IV antibiotics every 4 hours until your baby is born. Usually that is penicillin. If you are allergic to penicillin, we can do something different. The reason that we give it every 4 hours is because it's not as effective if your baby is born with greater amount of time than 4 hours in between your baby being born and the last dose of antibiotics. And since we don't know when your baby is going to be birthed, every 4 hours until we get there. So let's talk about what can happen if your baby gets sick from group beta strep. If you don't receive antibiotics in labor, 1 to 2% of all those babies will get sick from GBS. Trouble is, we don't know who's who until babies get sick. With antibiotics, we can decrease that risk by 80%. In the year 2015, it was estimated that in labor antibiotics prevented approximately 29,000 cases of early GBS disease and 3,000 early newborn deaths, mainly in high-income countries, so like in United States type areas. If your baby gets GBS, they can get sick in one or more of 3 ways. 1, they can develop a full body infection, is like a blood infection called sepsis. They can get GBS pneumonia, which is an infection in the lungs. They can also get meningitis, which is an infection around their brain, or a combination of those. About 5% of all babies who get sick will pass away. And the babies most at risk for this are the ones with these risk factors. The ones with the little asterisks beside them are the most common ones, or the ones that put you most at risk. Being born preterm, having a long time between when your water broke and your baby being born, or if you had a fever during labor. Other ones that can still affect what's going on are if your water broke before your labor started, if you had an infection inside your uterus called chorio, or if you had a baby that had GBS illness before. Also, if you've had anything placed inside your uterus during labor, if you had your membranes stripped or swept, or if we find GBS in your urine at any point, because that can be like, yes, you definitely got to jibs. Or if you've never had a baby before. These are all risk factors for that. But here's the thing. 60% of infants who develop early GBS disease have none of those risk factors that I just said, except for the fact that the mama had the jibs. That's why we recommend that if you have GBS, we go ahead and give you antibiotics, because we don't know which baby is going to be the one that gets sick. There's so many articles about parents, especially who live in countries where GBS screening is not a thing, where their babies have passed away, and super quickly. This baby was just 30 minutes old when she passed away. So we can do a wait and see kind of thing, like wait and see if your baby gets sick, but sometimes it's too late. And when we can decrease that risk by 80% just by giving mama antibiotics in labor, that's a significant risk decrease of something like that happening. So let's talk about the most common reasons that I hear of people not wanting to do antibiotics when they've got the jibs. Number one, I don't want to be hooked up to an IV the whole time. Great news. When we give antibiotics for group beta strep, it runs in for 30 minutes every 4 hours. That's it. And you can be unhooked completely in between that time. Number two, that it's going to negatively affect your baby's microbiome. Now, your microbiome is basically the dance of good and bad bacteria in your gut. Now, the trouble is, antibiotics can't tell the difference between the good bacteria and the bad bacteria, so it just says pew 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 and gets rid of a lot of it. And then it takes time to build that back up. Now, they've done studies on this, okay? And they found that it does appear that IV antibiotics during childbirth have a short-term negative effect on the infant's microbiome, but that negative effect can be lessened by vaginal birth, and breastfeeding or chest feeding. Research is still needed to determine if there are any long-term immune effects associated with the temporary reduction of beneficial bacteria. But let's say you don't end up having a vaginal birth. Let's say you end up having a C-section and you either cannot or do not want to breastfeed or chest feed. You can also do things like donor human milk, probiotic supplementation, or formula with probiotics to help them recover from any negative microbiome impact. Whether right or wrong, as a nurse and a mom, my thought is always, what is the worst case scenario? Like, if I let my kids watch TV while eating cereal on the couch, the worst case scenario might be that they spill their cereal milk on the couch, right? If I let them eat their cereal in the middle of the road, there's a little bit different of a worst case scenario possibility. So, if the worst case scenario in not giving antibiotics is that my baby could pass away, and the worst case scenario in giving antibiotics is that they could have a temporary reduction in their microbiome, that is a risk benefit association that I have to do for myself. For me and my informed, empowered decisions, the risk was worth it to me to give those antibiotics, but you have to do that for yourself. And let's talk about what would happen in the hospital if you either chose not to give antibiotics, or let's say you came in and just birthed a baby real quick and you didn't have time for that. The pediatricians would want to watch your baby for longer. So this could mean a longer stay in the hospital, because they want to catch those subtle signs of early GBS illness before it gets worse. And since babies can't tell us, like, ooh, I'm not feeling so good, it will take longer for us to notice those things. These are some signs that we would be looking for. And part of the trouble is some of these don't happen until it's a later sign. And if you're to go home and bring the baby back in once you start seeing these things, it can be very difficult to treat that infection. So GBS infection can happen at birth, yes, but you can also have late GBS infection, which can start anywhere from 7 days old to 3 months old. And the antibiotics in labor would help prevent that by 80%. Listen, I worked in the ER. I am all about some judicious use of antibiotics, and I don't think that we should be throwing antibiotics to everybody and their brother. But using antibiotics prophylactically in labor can decrease your baby's risk of severe illness by 80%. And I think that's a pretty good deal, but you have to make your own informed and empowered decision. And I hope that this information helps you to have more information to make that informed and empowered decision. If you want more information, evidence-based birth, GBS. Google it up, and you can read all about it.